just need to have an overview before we start the whole. Yeah.
Okay, so the name of the like 2 months ago to help the government of Kenya in the process of contact tracing and all is when you download the app or when you install the app, it will ask you for your register you into our database. And then if you grant their permission to use your location.
The name of the app is COVID Tracer. It has several aspects of it. Yeah. The first thing is that it has a function of self-screening test, exposure and such. Then there is an algorithm that calculates whether you've got a high risk of contracting COVID or not, low risk having COVID, and to give you some advice. The other part is it has an aspect of hotlines.
The phone that has the application on sends some information, the time and the location stamp, every 3 minutes to our servers. So this way we are able to gauge. For example, we can do like 5 looking at time points, saying after we want to see people who have been in contact for the last 15 minutes or the last 9 minutes. So it's really possible to using that timestamp and the location stamp to know how long were these people closer together, okay, and does that constitute significant risk of transmission. So we're using this to sort of avoid unnecessary alarms or what are called the false positives. Okay, so so in case you are just passing nearby somebody who, for example, has a contact, then you know that will not be significant enough to constitute you to get a contact tracing message. The current situation where you have contact tracing depending on memory, of people. How many people have I interacted with? Who was that? Our app really objectifies contact tracing and uses technology to leverage to avoid people can easily forget. So, and also we safeguard personal data and privacy in that we anonymize. So once we send you the contact tracing message, it's anonymized. We don't tell you who that was that you came into contact with. We just give you a message that says, Mr. So-and-so, you in the last 14 days, somebody you came into contact with has now turned COVID positive. Please call this number for more direction or self-isolate and get the testing. So it's really anonymized because we really have to be cognizant of the medical ethics that to preserve confidentiality and privacy as well.
The manual process of doing contact tracing is very expensive. So the app tries to reduce the cost of doing contact tracing in a way that, as it has been explained, if you come across somebody who has the app and who, let's say, has been confirmed to have COVID, then you should be able to receive an alert or a message telling you that you need to go and do the testing. So this way we are trying to remove the barriers and the associated cost that is involved when doing the contact tracing manually, or when you ask somebody the number of persons they came into contact with. So by using the app, we think that the Kenyan government will stand in a position of accuracy, and it will really help the government if they can use the app to facilitate the contact tracing. The same thing or the same idea can be applied to tackle maybe other epidemics that may come up. And also we normally have outbreaks such as cholera within Kenya. So we think that the app can be able to do the same thing in controlling such epidemics and also providing the community with the necessary awareness.
And the first functionality, or how it works, is that the first thing, it has an aspect of self-screening, whereby once you upload, once you have the system or the app in your phone, the first thing that you do is that you do self-screening. It takes your age, for example, whether you have come across anybody who has tested positive for coronavirus, and there's another aspect of whether you have some confirmed cases within your jurisdiction, and how did the contact happen, and so on and so forth. Once you key in all that data, the first thing that it works is that it has an inbuilt algorithm that calculates whether you have got a low risk of contracting COVID-19 whether you have medium risk of contracting COVID-19, whether you have got high risk of contracting COVID-19. So once you key all that data, it gives you instructions. It give you instructions whereby whether to do self-quarantine, whether to go for testing, and all that advice. So the most important aspect about this application is the aspect of contact tracing. And how it works is that if, for example, I happen to contract COVID-19, what the government or the administrator will do at the back end in our other system is that you only need to key in my phone number and instruct the system to do tracing. The system will compare my data, my location and timestamps against all the other people. And if there's an overlap, then the system will automatically generate an SMS instructing everybody that I've come across with that on this particular date, at a particular location and time, you came across somebody who has now tested positive for coronavirus. You are advised to do self-quarantine. Then it will automatically pick the nearest hotline, depending on your location, and instruct you to contact that location. Then on the administrative portal, it will automatically generate a list of all suspected cases. So the government or the administrator will not have a hard time asking you whom do you come across with. He will automatically forward up that case, forward up from the SMS, because the SMS that you have received, everybody who has been contacted by the system his contacts are also generated by the system on the other end. So the government will just be doing a follow up that on this particular date you receive an SMS. Have you done as you were instructed? So basically that's how the system works.